starters, ulcer can be referred to as a situation in which acid eat away the stomach lining. In our stomach, we have various lining, but the one that is uppermost is called the mucosa. When that mucosa is attacked by the acid produced by gastric juice in our stomach lining, it will create some sores there, which could eventually lead to bleeding. That is called ulcer. The leading cause of peptic ulcer is known as a bacteria called Helicobacter pyloricus. That's the leading cause. Another cause is anti-inflammatory drug. I wouldn't like to mention some drugs here, but you that are ulcer sufferers, when you go to the clinic, they always tell you to beware of a particular drug called aspirin. The chemical name for aspirin is acetylsalicylic acid. It has acid. Now, when you have acid to your sore, what happens? Yes, your guess is good as mine. It's going to result in the intestine producing more blood. So when you stool, you see blood in your stooling. That is called malignant stooling, And of course, cigarette smoking too is not good for someone who is having ulcer. Alcohol is not good. Depression and stress. When you want to, if you are having issues with ulcer, you should know how you stretch, especially the abdominal wall, so that it doesn't infringe on, the ulcer. Then we have three types of ulcer, like I said. Peptic ulcer, the one that occurs in the esophagus, which is called the esophageal ulcer. Then we have the peptic ulcer of the stomach. That one is called gastric ulcer. We have the duodenal ulcer. Then diet is very, very important. But when you're having all these symptoms, you should know that probably you have ulcer. Chest pain that later spread to the back, that's in the case of esophagus ulcer. Pain in the middle belly, that is peptic ulcer. And of course, pain in the lower abdominal part, that is duodenal ulcer. Lack of appetite, severe low weight, And of course, now, these are the foods you should avoid if you have ulcer. Pepper, alcohol, nicotine, caspacin, aspirin, ibuprofen, milk, beer, coffee, and caffeine. Those are the foods you should avoid. Now, what are the foods you can eat? Because if you tell you to avoid those foods, you can take food like avocado pear, ripe banana, like the one we just talked about, unripe banana, pure natural honey, fresh cabbage juice, then mixed total. Dr. Okoro is on the program with us today. Doctor, you are welcome to the program.
Thank you.
Please, can you introduce yourself more to the general public? Because I've been talking about you for almost 2 editions now that you are coming. Thank God you're able to make it today.
Thank you very much.
So please, introduce yourself to Nigerians.
Yes, my name is Dr. Ignatius Chooks Okoro. I actually developed interest in finding a solution for peptic ulcer disease, and we have developed a protocol to tackle it.
Dr. Okoro, why have you taken special interest in ulcer?
It is actually dated back to sometime in 2002 when my sister was actually down with ulcer and was at the point of death. I had been a researcher on herbal solutions to life. My sister was diabetic, but at this time she could no more walk because of ulcer pain. So that was what actually triggered my interest in research. So it took 14 years for us to discover and confirm a solution.
14 years, you see?
14 years. Because I took off this research in particular in 2003. I made an inroad in 2008 and then completed the patenting process internationally in 2012. Scientifically, two major things. The first 80% population that have ulcer is caused by a spiral-shaped bacteria that is known as Helicobacter pylori, otherwise called H. pylori. It lives in the acidic environment of the stomach. This bacteria also plays a good role in the body because 50% of the world population harbor this bacteria in their system. But when it goes to wrong places in the stomach, it begins to give problem. The next 20% of people who suffer ulcer is as a result of intake of non-steroidal anti-inflammatory drugs, pain drugs.
And those are in majority.
Yes, scientifically, these are the two major causes. For example, people think that fasting causes ulcer. Scientifically, fasting will always give you the symptom that you have ulcer. Ulcers are very painful and they are very deadly. Some ulcers are actually asymptomatic, which means it does not give any pain. But to know that you are suffering ulcer is either you are having the pain, most especially sometimes under the lower breastbone, caused by the digestive acid, which is unreceptive of the stomach. The stomach cannot receive it well because it's poor. The stomach is.
We have another caller from Lagos. Mrs. Deborah from Lagos. Good afternoon.
I heard that the ulcer is hereditary.
It's hereditary?
Yes, is it true?
Okay, doctor.
No, that's a delusion. Ulcer is not hereditary. If you want to stay out of ulcer, there are two major things you must do. Clean environment is very, very important because H. pylori breeds in a dirty environment. The reason why it is very prevalent in the north probably is as a result of the kind of food. Before you make food and use your ordinary hand to mix up, after going to the toilet, you have to wash your hands so well and sterilize it before you touch food. Otherwise, the bacteria will mutate inside that food, and then when you put it in your body, and then you have, sooner than later, you have a peptic ulcer. Also, people who are taking drugs, people who are engaged in probably hard drugs, pain drugs like tramadol, that is not actually recommended for ordinary people. It's recommended. They're supposed to be recommended by a doctor for severe pain. Those of you who are taking pain drugs generally that we don't need to mention.
Without prescription.
Without prescription. Pain drugs are not supposed to be taken for a long time. Like alabuku and all those things contain a lot of acid,
Yes.
which erode your system and eventually become you forms up sores in your stomach.
I think you have